The Good Samaritan Clinic provides health care to people who don't have health insurance and can't afford it. They serve Tuscaloosa, Greene, Hale, Bibb, Pickens, Sumter, and Fayette counties. They're also a United Way agency. Julie Citizen is here from the Good Samaritan Clinic to tell us more. Julie, thanks so much for being with us today.
Thank you for asking me.
It's nice to see you again.
You too.
Now, we have had so much has been said and made about Obamacare or the health care reform bill or whatever you want to call it. You guys are on the front lines of the problem that we have with health care in this country. From your perspective and what you guys do, helping people who, in most cases, they have almost nothing.
Yeah, we take care of the poorest of the poor.
There you go. With those people, any of this stuff that we've been fighting and bickering about, is that going to change anything for your day in and day out clientele?
Not much. And I think that even if Obamacare is implemented, it's still going to take a long time to put everything in place and figure out how to make it work. And then after that, there'll always be gaps. You know, what we're learning from the National Association for Free Clinics is for us to be ready to respond indefinitely. The need for free care is not going to go away. We were talking a while ago about people that have no health insurance and no income are really not concerned about a fine if they don't pay for insurance. They don't have anything to, So, you know, even a very inexpensive or what we would consider an affordable health insurance is probably out of range for people who are severely underemployed or out of work altogether.
All right, let's talk a little bit about what you guys have been seeing over at the clinic because you mentioned during the break you guys have you've been covered up, super busy.
Yeah, we've had a waiting list several times throughout this year. Right now we have a waiting list for new patients. We just continue to have a demand that's bigger than what a volunteer medical staff can completely keep up with. I like to think we make a big dent in it. We took care of 750 patients last year. That is a big dent. When you consider that for most of them, we're their primary physician and they come and see us 3 or 4 times during the year. So that's an awful lot of free medical care that's been given.
Absolutely. And you guys are a United Way agency. What does United Way help you do?
They pay for 18% of our annual budget. Our budget is very bare bones since our medical staff is free and we are in a building that the Baptist Association owns without rent. So we're pretty much medicine, utilities, medical supply, insurance, small staff, not much extra. And then of that very skinny budget, 18% comes from United Way.
All right, there you go. Julie, thank you so much for being with us today.
Thank you.
You can find out more about the Good Samaritan Clinic online at gsconline.org or by calling 205-343-2212.